All right. So, what about Nicole? Have you been maybe thought about food and drug interactions?
Honestly, no. I really a cup. Actually, the only one I have is grapefruit. I don't eat
Hmm.
grapefruit because I know that I was told by my doctor that could interact with medications I take. But aside from that, I always try to talk to the pharmacist before I take a vitamin, or do some research to make sure it's okay. Because I take vitamin C, um, and vitamin D, and then a multivitamin. So I looked those up and they were okay. But aside from that, I never really thought about it.
Yeah, and I think as actually as part of as a clinical dietitian, I was always really fascinated by the food and drug interactions because I was able to see on the clinical practice. For instance, if a patient with seizures require Dilantin and they were taking a supplement with it, it will completely, it will not absorb the Dilantin at all. So the seizure activity will continue.
Wow.
So there are very similar things like that. Like metformin interferes with the metabolism of vitamin B12. So many patients with diabetes, for instance, or pre-diabetes taking metformin, and eventually they feel like extra fatigue, and they don't know where is that coming from. Not only like from the diabetes itself, but it's the metformin is affecting the vitamin B12 absorption. So those are like interactions that rarely, usually a dietitian that provides guidance with this. But unfortunately, I don't see a lot of rheumatologists referring their patients to dietitians to kind of do that kind of review. At least that hasn't been my experience. So today we'll just really briefly, because I don't want to like kind of review a lot of the jargon of pharmacology and pharmacokinetics. But in general, what I want you to see is that the food and drug interaction is modifying the effects of the nutrients, and it goes backwards too. So the drug can modify the effects of the nutrients and vice versa. So here's what happens with the food and drug, and it kind of goes both ways. So effects of food and nutrients on absorption. So that means when the drug or nutrient proceeds from the site of administration to the systemic circulation. Then you go the effects of food and nutrients on the drug distribution. So that means where the drug or nutrient goes from one location to another in the body where there's going to take the effect. Then you have the effects of food and nutrients on drug metabolism. So that means where the nutrients or the drugs are chemically changed by the action of enzymes in the intestinal tract or liver. So mostly the liver is where we have the concentration of enzymes that are going to metabolize the drug or the nutrients. And then we have the effects of food and nutrients on drug excretion, and that has to do with the metabolites that are removed from the body. And that has to do, compromises a lot the gastrointestinal tract in order to get rid of all the excess of a drug or the nutrients, right? Because you have to kind of scrape what the body doesn't need. So when it comes to the metabolism, when the absorption, distribution, metabolism of expression of the nutrients is called nutrient kinetics. And when it comes to the drug, it's called pharmacokinetics. But we're not going to go more advanced than that. So one example is Fosamax or alendronate. If you ever heard of that, it's commonly prescribed for osteoporosis.
Yes, I've heard of that.
And so it's a very tough medication on the gastrointestinal system, and unfortunately it has to be taken on an empty stomach because otherwise it will not get absorbed at all. So you'll be taking like placebo.
Oh wow.
And when you take it with coffee or juice, it actually decreases the activity by 60%.
Jeez.
So that's another effect. So another one that we rarely like amitriptyline. That's another one that is used for anxiety, depression, right? And also being used for pain, because a lot of these medications have been used for that. So it looks like a high fiber diet may decrease the absorption of amitriptyline. And but I don't want to discourage you from taking, eating of high fiber foods. I would like to see more what is the option of getting rid of that medication altogether. Because the side effects is like increases weight and appetite, like by increasing appetite. And that appetite is for sweets and like refined carbs. And it also increases the need of vitamin B2. So that's one of the part of the A-B vitamins that helps the body metabolize fats and proteins. So these drugs have like a very effect on metabolizing like the vitamin, the group of the B complex vitamins, which are essential to metabolize carbs, fats, and protein, and to get all that energy into the cells. So that's why when we're low in the B complex vitamins, is that way we feel so tired. But the B2 vitamins, you can easily find it in organ meats, almonds, mushrooms, soybeans, milk, and yogurt. And usually flours and cereals are fortified with B2. Other medications that affect the excretion of the B2 or the metabolism is the diuretics, such as the, oh my God, tell me that name, hydrochlorothiazide.
Hydrochlorothiazide.
Yeah.
Mhm.
So that medication tends to cause to lose more of B12 in your urine.
Oh wow, I didn't know that because I take that.
Mhm. I took a lot of the examples, tried to use medications that all you guys reported, so that it's relevant. So the disease-modifying anti-rheumatic drugs, or the DMARDs, so the most commonly used is the methotrexate. I'm so glad I'm not taking it anymore. And here, basically, it actually fights with the site of absorption with folic acid, because really the idea of the methotrexate is to kind of destroy the DNA, and it partially inhibits the immune system. But then what happens too, when you take methotrexate, it really interferes with the metabolism of absorption of folic acid, and that's why it's recommended to take folic acid, but on the days that you're not taking methotrexate, because you don't want that competition. You still want the methotrexate to be effective. So if you take folic acid the same day, that is not going to be, the methotrexate is not going to be as effective. Also, food delays absorption, and oral methotrexate causes, like, I think, nasty oral and digestive symptoms. And this is interesting because back home in Colombia, when I was prescribed methotrexate, I was given the injection right away. Whereas here in Canada, I was given the pills. And so, and now more studies are showing that injectable or subcutaneous methotrexate is more effective and has less side effects, especially with the digestive system. Have you ever used methotrexate, any of you?
I did.
I was on pills. It was like the first drug that I went on with for after my rheumatoid arthritis diagnosis, but they gave me too many upset tummies, and my rheumatologist really warned me. She's like, you're probably gonna feel side effects from these pills. The injection's better. But in Canada, you have to go the cheapest method first.
I know I had to fight, and I said, just give me the middle.
Yeah.
I don't mind. And also methotrexate has interfered once again with the vitamin B2. So if you're taking methotrexate, you're taking metformin, you're taking diuretics, you're pretty much depleted of B2 riboflavin. So
is that why people feel so much fatigue and like the hangover effect when they take their methotrexate, or is that like a whole nother ballpark?
It is possible. I think we don't really talk so much about that particular vitamin being lost, right? And I think the risk is that usually when you take the B complex vitamins, it contains folic acid. So that supplement should be put on hold also like a day before and after in the day of the methotrexate. And but that could be and this is actually something I learned recently when I was reviewing for this presentation about the role of the methotrexate and metabolism of B2.
Hmm.
And a lot of this information actually came from research done in South America.
Really?
Mm-hmm. So here we have our, how said it, the necessary evil.
Oh yes, prednisone.
Satan's Tic Tacs.
Oh my God, prednisone is like, ah.
Yes.
So prednisone has many metabolic effects, but I'm just going to touch on like some of the most common ones, which is the interferes in the metabolism of calcium and vitamin D. And also prednisone, even though it's an anti-inflammatory, it does inhibit. I think this is how it actually works, right? The mechanism of action of the anti-inflammatory action of prednisone is that inhibit a particular enzyme that releases polyunsaturated fatty acids that actually produce the inflammatory type of fatty acids in your body, like the prostaglandins and leukotrienes. And so that's really the purpose of prednisone, and that's why there is prescribed. It's like you have a flare up and the inflammation is not coming down, then that's kind of the emergency tool. But then the body gets so used to that kind of load of anti-inflammatory properties. But in the meantime, this is what it's doing. So the prednisone and bone health. So have you ever heard, like, you know how when you are pregnant and you're malnourished, but the baby still is able to grow, right? It is still able to maintain their weight. And one of the reasons is because some of the osteoclast or some cells that we have in our body, it kind of scrapes the minerals from the bones and it gives it to the baby, right? Prednisone does this, but it doesn't give it to anybody. It just releases it. And it leads to bone loss and also muscle wasting.
Mm.
So that's why when we are on prednisone, it's so easy also to not only we gain weight from the increased appetite because it's because of the cortisol, the effects of the hormone itself, but it also if there's muscle wasting, there's not a lot of muscle mass that is going to metabolize a lot of energy. So there's more chances for us to gain weight in form of fat rather than muscle. So that's why this medication is so evil.
Mm.
It's so helpful, but it's, in the long term, is so evil.
It
Now,
is. I have to have a double hip replacement because of prednisone.
Oh man, and that's a long-term effect, necrosis of the bone. And I was monitored after I had my baby that the doctor was concerned that I was developing that, and I was freaking out.
Okay, so now I have two comments on this.
Mhm.
Now, with people having RA, they're more likely to develop osteoporosis. Does the use of prednisone have anything to do with that?
Yes, it's like a double whammy. So it's
Yeah.
like from the disease and from the prednisone.
Yeah.
So
That's bad.
it's
And then
definitely. Mhm.
the other thought that came across my head is I've read before that people living with rheumatoid arthritis usually have more body fat and it's harder to get rid of. Do you know any truth behind that?
It has to do with the rheumatic muscle wasting. It's actually, oh my God. I know the term. Cachexia, rheumatic
Yeah,
cachexia.
it starts with an A.
Yeah. So cachexia, which is related to the muscle wasting, but that happens mostly with a high activity disease. Like if the disease isn't well controlled, there's a low level disease level, then it's usually you don't see the muscle wasting. But when there is a high disease activity, there's like this muscle wasting.
I experienced that when I was first diagnosed in my disease with the highest it's ever been. I remember I had no appetite and I couldn't eat for like a whole day. Nothing on. I could just handle like eating an apple, and I just wasted away.
And that's actually a pretty like a common symptom of like a high disease activity, rheumatoid arthritis, and when we're fairly like a newly diagnosed. So that's why like a early detection and early treatment is so important, because the muscle mass is very difficult to gain back, right? So because
it took years.
it took years, right? And I still feel, and then on top of that, okay, you control your disease, but you're on prednisone. The prednisone is not helping either.
No, my rheumatologist was like, I'm never giving you prednisone unless like emergency situations.
And that's like probably the advantage of you being diagnosed, let's say, relatively recently.
When biologics happened, yeah.
Exactly, because I've been on prednisone almost for 20 years.
Yeah.
And I haven't been able to get rid of it. So even though I'm at a low dose, it's still causing problems. But as we're going to learn in 2 weeks about cannabis, cannabis is actually helping to restore all the osteoblasts, all these.
Really?
So some part of like CBD particularly seem to be associated to kind of restoring the osteoblasts that helps with the osteoporosis.
Oh, good.
So that's actually kind of emerging evidence, and it's quite exciting, especially in the studies of postmenopausal women, where they're doing these studies to kind of prevent the osteoporosis caused by hormonal changes and that kind of thing. So it's quite fascinating. Then we have the other situation with the weight gain, right? So when the prednisone is prescribed, your body, it usually is prescribed because your body is not making enough corticosteroids, like your own adrenal gland. You know, those little kind of, I would say like the Santa hats that are above our kidneys. Those glands are the responsible to release cortisol. But when we don't release enough to reduce the inflammation, and that usually happens in rheumatic diseases, and so that's what we're prescribed prednisone. And not only we have the weight gain, but it's a very strange fat redistribution. So the fat actually happens, it happens in the back or base of your neck. And then also, right? So, and then it feels like you have like a lymph node, but it's actually fat that could be, it's accumulating from the long-term use of prednisone. But the side effects really depend also the dose, the duration, and the disease activity. So I personally have never experienced increased appetite because I take prednisone. But when I increase prednisone, my symptoms are more related to sleep disturbances and anxiety. Another thing that is so beautiful about prednisone is that it increases water retention. So when you actually have a high intake, high sodium intake, you're aggravating that water retention. So you get swelling in your legs, or like feeling like your body's kind of swelling up. So that's why when we're taking prednisone, it's better to keep that sodium under control, like very minimum, and that's where with the use of herbs and spices come into play, so you don't use as much sodium when you prepare your foods at home. And also it's important to increase the amount of potassium or foods containing potassium, because that combats the water retention caused by corticosteroids. I see your hand, Eileen.
Yes, I finally remembered I could use that function. I hate talking over people, so sorry if I do. Sodium. I have a question about that because living with rheumatoid arthritis, obviously we get swelling and we want to be conscious about reducing any swelling in our body. How much is a healthy amount of sodium a day?
So that will be like about like 2,000 milligrams. And like, what is 2,000 milligrams? It's typically it's like a 1 teaspoon of salt.
Yeah. Okay.
One
And
teaspoon.
that's even if you aren't on prednisone?
It's better, especially when you have chronic illness. It's ideal. So if you're not using prednisone, like up to 3,000 milligrams could probably, it could probably be okay. But think about even like a 1 tablespoon of soy sauce. I believe it could have like 1,500 milligrams of sodium, just 1 tablespoon of soy sauce.
Bragg's liquid aminos, I thought for the longest time had no sodium, but they do.
Yeah. And then if they still have like some of the substitutes, it still probably have half of the content, right? So it's kind of nice to get the flavor. But I find that here in North America, because everything has sodium, it has changed over the years, I gotta admit.
Yeah.
No, like when I came to Canada, everything was salty and sweet.
I try to get the lower salt version of stuff if I'm buying anything, just so that I can make or subconsciously make those choices to reduce my salt intake.
And that's very good. And start using more herbs. Like the more herbs you use, the more flavor you add, the less salt really you need. And
I typically only use when I cook, I use Himalayan pink salt, just a little bit because I'm not a fan of overly salty, and I use a lot of garlic.
I want to ask something. And do you have any sources of iodine? Does it have iodine like your pink Himalayan? So I don't think it has.
I'm gonna go run into.
Because I think we have to be very, like all these gourmet type of salts, they tend to just get rid of the iodine, which is very like a traces amount. And iodine is important for the thyroid function.
Okay, this one, it doesn't say that. It just says Himalayan salt.
Yeah, so it will be worth to check with maybe the company, because that's really the main source of iodine that we have in our diet, and it's the kind of fortified in the salt. So something just because we need to balance, and we are at risk of developing like thyroid problems with autoimmune diseases. So just keep that in mind. And so as far as potassium, but it's also be very careful. Like it's better to use like less sodium than actually use like those salt substitutes, because those ones are also really high in potassium. So you want to get the potassium, get it from foods rather than from the salt substitutes. Especially, I will say be cautious in patients with lupus when we have to protect the kidney. So we have to have a very balance of all these electrolytes. And the main sources of potassium, when I work in a nursing home, and they have like a kidney diseases, these were the main foods that we increase or eliminated, depending on what we needed. So it was prunes and dates, bananas, potato, oranges, and tomatoes.
Those are ones that we should eat.
So you should eat, if you don't have any kidney problems, right? So there's no kidney deficiencies or anything, right? So these are the foods that have the most content of potassium. But also the melons, like cantaloupe, is high in potassium. But these are like the ones that give you like the most potassium. And here's another one that is very interesting, like the PPIs. Have you used like a
Nexium or
Nexium, exactly those, Pantaloc, all those gastroprotectors, and it's like a chain reaction, right? So you start taking prednisone, you start taking NSAIDs, my stomach hurts, so let's get the PPIs and antacids, and that all becomes like a snowball of deficiencies. Oh, it's so Eileen, what did Cymbalta do to you? Sorry, I missed that one.
Pardon?
What did Cymbalta do to you?
Oh, Cymbalta made me have intense night sweats, and I noticed I was so hungry on it. I couldn't stop eating. And it's similar to that one drug that you kind of mentioned, because I was prescribed it because it helps with my mental health, but also it's supposed to help with fibromyalgia and OA pain.
Mm-hmm.
So yeah, that's interesting.
I actually take Cymbalta once in a while, and I tolerated Cymbalta better than Lyrica. Lyrica made me gain weight, like 20 pounds, which is for fibromyalgia. And that's where it comes that like how the nutrition and all these therapies need to be individualized, right? Because to me, I have no side effects from Cymbalta, but look at what it did to you.
Yeah. Oh, everybody's different. And sorry, quick question. Iodized sea salt, is that the kind of salt that we should be looking for?
Yeah.
Okay. Thank you. I never realized that one. And yet again, thank you for teaching me something that I did not catch reading countless articles.
So here is another one that is early used, like it's commonly used. And it's like, we say like pantol, Nexium. And so there is a hypothesis, right? Because we need the acid, gastric acid, for protection, for immunity. That's like one of the first kind of protective barriers. The acidity in our stomach. If we eat something and it has some bacteria, like that acid will like immediately kill it. So when we take these medications, we're actually taking away that protection, that layer of protection. It also decreases the absorption of calcium, because calcium needs that acidity as well. B12, there's another B vitamin that is highly affected by the decrease in gastric acid, and magnesium. And so by decreasing the absorption of magnesium is also going to affect the bone health, because you need calcium, magnesium, vitamin D, and K2 to maintain that bone health. So when you think about B12, it's particularly found in animal products, meat, eggs, and poultry, dairy. So that's why when anyone goes vegetarian or vegan, vitamin B12 must be supplemented. Like it's a must. But now we have available on the stores, like in the stores, the nutritional yeast. I don't know if you ever tried that.
I have. Mm-hmm.
So nutritional yeast is it's actually it's a great supplement that it provides B vitamins complex, and it's great for like a vegetarians. And actually it gives a really nice flavor to like your kind of plant-based dishes. You have a dip like made of cashew, and you add the nutritional yeast. It has like a cheesy flavor, so it kind of enhances the flavor of the food. So it's actually pretty good.
Yeah, I've heard some people, they just sprinkle it on like popcorn and things like that. I didn't realize that it had this kind of health benefits.
It does, and because many times when you think of yeast, you think of that substance that you use to make bread, right? So it's like,
Yeah.
but this is a different product. It's actually made, I believe, like from soy. There are other components. I'm going to share that. I should share probably a post about that, the nutritional yeast and how to use it. I've been using, I admit, I've been using it lately because I've been going more kind of on the vegetarian side. And I'm worried about these deficiencies because I'm not too crazy about supplements. Like I really avoid them as much as I can.
Now, sorry, I have another question about nutritional yeast and its B12 properties. Say if somebody is a meat eater, but they have malabsorption issues, so they're wanting to get a little bit extra certain vitamins, minerals in their body, would you say adding nutritional yeast is a good thing to add to your menu, even if you do eat meat?
But then we have to see if they actually need that deficiency, because there's like an anemia called pernicious anemia, and it's believed to be almost like an autoimmune condition where the body cannot really metabolize the vitamin B12 and absorb it. So I think in that situation, it's better to check the levels like the serum levels, just to see if there's an actual deficiency.
Mhm.
Because sometimes we just kind of go and take all these supplements, but we might not be deficient at all. Yeah.
Yeah, I've been told I'm low in it. So
So then in that case, I usually honestly like the organ meats are probably the best source of B12. I personally eat it like once a month. The chicken organ meats.
you
And I was
only need it
starting
like
with some.
once a month.
I eat it only once a month because I just don't tolerate it. I don't like it. Like, I mean, I like it, but it's just my body. I'm not used to. I'm almost like a plant-based. Just, I'm not tolerating a lot of like the meat itself. But I think it's just my body.
What about like I'm not a huge chicken liver fan unless it's in pate. Are there any like packaged pate? Is that kind of pointless? Just flavor?
Yeah, I'll have to check on that. But I always the key is look at the list of ingredients, right? Like you don't want to see a lot of additives to it. I think that's a great idea. That you could use if you don't like a lot of the kind of the liver or the organ meats. I don't know, Nicole, how do you feel about eating that?
You know what? I love chicken livers.
Oh yeah, okay, good for you.
I try to have organ meat. Like I love liver too. I'm so strange.
It's not, but for you, like on this, like thinking about like the metformin and all these kind of other supplements, I think is actually great. Like eggs also, like I eat eggs every day.
Me too.
So there are other options, right, for us. And then again, the nutritional yeast is definitely a great way to get more B12 aside from supplements. And also remember that the B12 deficiency, it's a lot of the symptoms are very similar like to fibromyalgia. So you feel like numbness, tingling in the hands, legs and feet, weakness, fatigue. So they might overlap. So it's worth kind of checking whether how are your B12 levels are, or is it really fibromyalgia, or is it that you're really low on B12? So something just to think about it. And magnesium deficiency can also lead to muscle cramps, osteoporosis, fatigue, and muscle weakness. But also remember that when you take magnesium supplements, they tend to also give you diarrhea. So just be very mindful of
Can
that.
that also cause stomach pain too from them?
It could, especially when you have those antacids that contain magnesium in it.
Okay.
Because magnesium, it's kind of used to neutralize the gastric acidity. So it can definitely, magnesium can give you some GI disturbances.
I wonder if that's been one of the culprits that's been causing my stomach pain.
It is possible, and magnesium is not really hard to get. Like you get it from almonds, pumpkin seeds, dark chocolate, peanuts, popcorn. So, and also there are studies saying that decreased magnesium levels increase the risk of depression. So if you have lower levels of magnesium and winter is coming, I think that's some of the foods that we need to kind of start packing in.
Now, liquid, you can buy liquid magnesium. Is that more tolerable on some people's body than the pill form?
It could be. I usually, when they come in the citrate form, it's better because the citrate form doesn't require the gastric acidity.
Okay.
So that's actually a very good question, because some of the supplements actually require the acidity. So you don't have that because you're using like a PPIs, or basically, or some of the conditions like Sjogren's syndrome can actually lower the production of acidity in your gut. Just that condition causes that. So here, just kind of briefly going like for the folic acid. So you know that significantly reduces the hepatic and gastrointestinal toxicity. So this is very important. So it's important to know that folic acid supplements tend to mask vitamin B12 deficiencies. So what's important is to always kind of have that balance of the B complex vitamins. B vitamin complex, what is it? B complex vitamins, yeah. And the folic acid. And look at this. So high intake of folic acid may decrease the zinc absorption. So, and then when we don't have, then when we have zinc deficiency, that's when it started having alterations of the taste. We also have, like, our immune system doesn't seem to be as, let's say, as healthy. I wouldn't say to boost it, but we still need to have a kind of healthy immune system. So calcium. I don't know if you might know this, but calcium, especially when it comes to calcium supplements, calcium carbonate, which is the most common and cheaper form of calcium, requires to be taken with food because you require more gastric acid to metabolize that calcium and get absorbed. Whereas the calcium citrate doesn't require the gastric acidity and is better tolerated. Calcium carbonate tends to give more constipation, whereas this one, the calcium citrate, doesn't have that much side effects, GI side effects. And also, because we need at least maybe 1,200 to 1,500 milligrams per day, especially we're taking prednisone. But it's good to remember that the body can only absorb up to 500 milligrams per dose, and that's a combination of supplements and food. So if you're drinking, let's say, a glass of like soy milk or regular milk, and you're taking, and that provides around 300 milligrams of calcium, and then you're taking like 500 milligrams of calcium carbonate, you're only absorbing, the body's only taking 500 milligrams at a time. So I'm not sure if you were aware of that.
I wasn't.
So that's something to think about. The vitamin D, we have, oopsies. So vitamin D, usually vitamin D3 is the type of vitamin that is more readily available and more very absorbed by the body. You can also obtain it from 45 foods, but because of the use at our people with rheumatic diseases and autoimmune diseases, they are found to be vitamin D deficient anyway. So it is still safe to say that 2,000 to 4,000 international units a day is a safe dose to keep those levels up, as opposed to like 800 international units that is recommended for the general population. And I usually like to recommend that the supplements that are in oil or oil-based capsules, because it absorbs better, because the vitamin D is a fat-soluble vitamin, and it's better when you take it with something, other foods that contain like a healthy fat. Give it like you eat it with fish, or you're taking it like a yogurt in the morning, but something that contains fat is going to help absorb it even better. Then we have the magnesium. There's no like a recommended daily allowance, but it's really easy to get magnesium from like nuts, chocolate, or cocoa powder or dark chocolate. Then we have the colored greens. And so just to make sure that it's actually very easy to get magnesium from the diet. Here's our vitamin B12. So vitamin B12, we need to consume it because the body doesn't produce it. And vitamin B12 deficiency is associated with depression. Something that to think about. So selenium is an antioxidant. It's like a trace mineral, but it's essential to support your immune system health. And actually, I was reading that when you take medications like Arava or those or any immunosuppressants, and when you take those supplements like echinacea, it actually counteracts the effect, because those ones tend to boost your immune system, and you don't want to boost your immune system.
That's true. And kombucha too, I've heard.
Mm-hmm. And so zinc, oh my goodness, okay. So zinc, it seems that in patients with rheumatoid arthritis, there is like low levels of zinc related to the inflammatory process. And also, again, if you're taking NSAIDs like ibuprofen, naproxen, and prednisone, it can also decrease the zinc levels. But usually you can get zinc for, like, you don't need a lot of it, and that you can get it from your legumes, nuts and seeds, and seafood. The copper. This is copper is a very interesting, right? Because it actually shows that the copper levels are at times of disease activity. So the copper level seems to increase, and it seems to have actually an anti-inflammatory effect when there's a higher levels of copper. As you can see, again, like a dark chocolate is another great source of copper, and seafood, mushrooms, cashews. And this is what is very interesting. So zinc and copper, they kind of work kind of an opposite sides. Like one, when you have an increase intake of one, it kind of decreases the other, and vice versa. So many times when people say like, oh, I want to prevent getting a cold, so I'm going to take a zinc supplement and over the counter. But when you take more than like 50 milligrams a day of zinc, like for over like 2 or 3 months, it can actually deplete the copper sources, right? And that anemia is very hard to treat when you have that imbalance between zinc and copper. So something to think about when you are taking all those supplements over the counter, promising to get rid of like cold symptoms.
I didn't have to think about it. I experienced it.
Right? So it's very rare. It's very, very rare. So I really hope they get to the kind of the culprit of your copper deficiency.
Yeah.
Because I wonder if they can also run some genetic testing just to see if there's any abnormality of the enzyme that is the celluloplasmin. So that enzyme is really important in the metabolism and absorption of copper. So if you might be deficient in this enzyme, that might be a problem too.
Mm-hmm. The weird thing when I was diagnosed with my copper deficiency, though, the copper supplements are incredibly hard to find on the internet. And actually finding anybody who speaks about a copper deficiency on the internet I was the only one who's talked about it so far, apparently. But the supplements that I found actually had zinc and copper in them. And luckily I didn't have too low zinc. I had more low copper. And taking those supplements actually worked for me.
No, and it should, because it has to have a balance, and I think this zinc also helps to kind of control the enzymatic action of the ceruloplasmin, so it's not like an overdrive. Yeah. So I think there's got to be a balance between zinc, copper, and iron supplements as well. So they were like really tightly connected, zinc, copper, and iron. I actually think copper deficiency when I used to work in the nursing homes with the elderly, because a lot of the paste that they use for their dentures is high in zinc. So that's how we kind of detected a few cases of copper deficiency because of that paste that they use. Interesting. So that's what I wasn't like. I'm not completely unfamiliar with it. So fortunately, they have changed the formula for that for the poor elderly going copper deficient because of the paste that they were using, the glue. Let me see. So you said if you do vitamin D light therapy, do you still need to take vitamin D supplements?
Yeah.
I wouldn't think so, because it's just getting like almost like the sunshine, right? Yeah, are you still doing it?
I didn't do it over the summer. I kind of stopped after I moved, but I'm gonna, oh gosh, it's already October. I gotta get on it. I'm gonna start it up again.
Yeah, I wonder if that will have a better effect like in the winter time when we don't really have any daylight or any sunshine.
It does. Every time I tried it, like you go once a week and it's only a few minutes in this booth. You stand there basically naked. And it is strong enough if you don't put your correct like skin type, you can burn. I burned a little bit when I did it on my chest and my bum because I forgot to keep my underwear on. So that was really comfortable for a few days. But every time I went, I did feel a little bit of like mental clarity, a little boost of energy, and I felt kind of warmer and just kind of relaxed.
And I wonder if, for patients with lupus or even the ones taking methotrexate who are like photosensitive and cannot take the direct light, will that be okay? That I don't know.
Yes.
I don't,
Yes,
is that okay?
It is.
Yeah.
So it is not using those type of is it UVA or UVB rays? So I wasn't on Celebrix then. So you do sometimes like you get a base pinkness for a few days, but it's not like a real sunburn. It doesn't peel. It's just like you've got like a prickly sensation. Your skin goes a bit red for a bit, and it goes away in like 2 days. And it's only on areas that don't get exposed to sun very often. And if you go in the machine for too long. So I was a little too excited with it and put in for too long. And also you have to start with a base, you have to gradually build up. So it is safe for people who are photosensitive because it doesn't actually have tanning rays. It doesn't tan you.
Okay, that's good to know. I still feel very weird because I'm extremely sensitive to the sun. I'm born in Colombia.
Yeah, I learned this summer too. I recently started Celebrix, which I didn't really know until I wrote the photosensitivity article that it would make me photosensitive. And I went to the beach one day and I forgot my sunscreen, and wow, that was a really good burn.
Yeah, that's I don't know about Nicole, but I think ever since I had Sjogren's and been on methotrexate, I can't be exposed to sunshine.
Methotrexate is definitely one too.
So now the omega-3s, like this is a very I'm gonna end with the omega-3s. And essentially what we're looking for is the long chain fatty acids called the EPA and DHA. I'm gonna give you like the whole name of it, but this is really what we're looking for when you're looking for a supplement. So essentially, omega-3s are really high in like fatty fish, right? So sardines, salmon, anchovies, and also another great source is the hemp seeds. Flax seeds, chia seeds also have, but the type of omega-3s that it contains is not, the body cannot really kind of convert it into the EPA and DHA as effectively, and it only gets up to like maybe 10 or 20% of it. 10 or 20% of that fatty acid gets converted into the anti-inflammatory version of EPA and DHA. So that's why you either kind of get the omega-3s from these animal sources or supplementation. And when it comes to supplementation, it's better to look for those who have like the natural triglycerides, which is the form of the fatty acids that you find in the fish. And the plant-based sources, if there's any omega-3s, also ideally from algae. It's funny, I was looking at it here. So that's another great source of omega-3. So I wanted to show you a few examples of omega-3s that I found. So this one is being a lot, like with my clients, they send me, oh, is this one okay? You can find it on Amazon. So omega-3, Nordic Naturals. So look at the fish oil. It has 1,000 milligrams per gel. But in reality, when it comes to the EPA and DHA, which are the anti-inflammatory fatty acids, it's only like 275 milligrams per capsule. And when you talk about the 2 to 3 grams of it, it's not the 2 to 3 grams of like the fish oil, it's the 2 to 3 grams of EPA and DHA combined. So there's another, actually, I think I saw it in, someone shared it, that the NutraC has a product called arthritis, specifically for arthritis. And you can see the amount It's 2,800 milligrams, almost what you require in a day, and 1.5 teaspoon. So that's something you can easily put in your smoothie. So you don't, it usually doesn't have like a fish's taste, but I still like to combine it with something.
I really love that NutraC brand.
Yeah, I really like it too. And they also have one with for dry eye, which is it contains the GLA, so it's like a gamma linoleic acid, and it's another fatty acid that it seems to be anti-inflammatory for the eye. So this one will probably be maybe helpful for patients with Sjogren's syndrome.
Can I tell you about another product they have that's amazing?
Mhm.
They have one that's called One Daily, and it's a smaller, or it's like, it's not smaller, but it's really good for those people that can't handle swallowing lots of pills a day.
I think so. So the NutraC, they have the One Daily. I like
They
their
have the
oils
tiny
too.
ones too. Yeah, they
Mhm.
have tiny versions too, which are good for people who can't swallow big pills. But yeah, I
Yeah.
really like their brand.
Yeah, I really like that. I usually promote, and they also have one that is a plant-based. It's made of algae. So for those who are vegetarians or vegan, that's a great option for them too. So that's what I got for you ladies today. I know it's a lot of information. It's a little bit more different than kind of the typical like make the menus and all that, but it's something to really consider when you're reviewing your medications and how they're interacting with the nutrient absorption and also the drug absorption. And maybe it's worth looking at it, is it maybe causing you more fatigue because the treatment is not being effective, right? Who knows, right?
True.
So here's I'm just gonna let's end the recording. Stop recording. Thank you, ladies.